high glycemic foods include things like cake, cookies, white bread, French fries, white rice, and crackers. And then the low glycemic foods are almonds, blueberries, avocados, whole grain bread, broccoli, and cauliflower. So you really want to focus on whole foods. The processed foods eliminate protein and the fiber, which help buffer the increase or the spike in blood sugar. If you're focusing on whole foods, they have fiber and carbohydrates that kind of keep you at an even keel with your blood sugar. All right, so some healthy snacking tips. You always want to watch your portions. You can use measuring cups and spoons to help. Don't eat out of family-sized bags or boxes, so you want to watch the portions. Don't snack in front of the TV or computer or while you're eating. I don't know who eats while driving, but don't do that either. It's not safe. You want to stock up on healthy snacks so you have them on hand. Shop the perimeter of a grocery store, so you want to skip the processed food aisles, the candies, the cookies, and the chips. And then what's really important while you're shopping is watching and reading food labels. So this is a sample food label. So if you look, there's actually 8 servings in the box, and the serving size is 2/3 of a cup. 230 calories, and then total carbs is 37. So you really got to watch that, because some people are eating a lot more than they should be, or more portions than really you're supposed to. So you could potentially be eating 3 times as many carbs as you really should be. So it's really important to get exercise as well when you're diabetic. Any movement helps. Benefits of exercise include controlling blood sugar, weight loss, and increasing your mood. It also lowers the risk of heart disease, blood pressure, and stress. So the goal is 150 minutes a week, or 30 minutes 5 days a week. You can start with 5 to 10 minutes of exercise. Any movement, walking, bicycling, swimming, or jogging is considered exercise. And then lastly, monitoring your blood sugar at home is important. So when you're newly diagnosed as a diabetic, we send you home with a glucometer, or we order a glucometer for you to pick up at the pharmacy. So with the glucometer, you're pricking your finger and measuring your blood sugar. You can do this once a day if you're a controlled diabetic, maybe more often if you're not a controlled diabetic. So typically, we'll have you do your fasting sugar in the morning before you eat, just to see how you're doing. More often if you're not controlled, so maybe before you eat and then 1 to 2 hours after you eat. The second picture is the continuous glucometer, or CGM for short. That sensor on her arm you can stick on, and depending on what brand it is, it's good for 10 to 15 days. If you have a smartphone, you can actually sync it with your phone through an app, and it gives you your blood sugar reading in real time. Not all diabetics have that, but it's good if you're uncontrolled or if you're on insulin to use that. if diet and lifestyle aren't enough to control your diabetics, or if you're diagnosed with diabetes and your blood sugar is really elevated or your A1C is above 7, it might be time to start an oral medication. This is not an exhaustive list of medications, but it's medication that we typically prescribe in the office. So metformin is really like a staple medication. It's pretty well tolerated and very cheap as well. So this helps lower blood glucose levels by making muscle tissue more sensitive to insulin. Major side effects of metformin are abdomen pain or nausea, diarrhea as well. The second medications are the DDP4 inhibitors. Januvia is a brand. They work by preventing the breakdown of naturally occurring hormones in the body, GLP-1 and GIP, and they stimulate the release of insulin and slows down stomach emptying. GLP-1 and the GLP-1 inhibitors, so common ones are Ozempic and Mounjaro. These mimic the effect of naturally occurring hormones in the body to help lower the blood sugar. They also slow down digestion of food to help you feel fuller longer. These medications are once-a-week injections. So once a week, you're giving yourself a sub-Q injection. The side effects that people typically report are nausea, abdominal cramping, sometimes constipation. And then the fourth medications are the SGLT2 inhibitors, Jardiance and Farxiga. These take excess blood sugar, moves them into the kidneys, and the SGLT2 inhibitors help excrete the sugar out into the urine instead of being reabsorbed. Common side effects of Jardiance and Farxiga are urinary tract infections and yeast infections sometimes in older people, as well as dehydration. So you have to drink plenty of water and stay hydrated with these medications. And then the last medication that we typically prescribe are the sulfonylureas. These stimulate beta cells in the pancreas to release more insulin. Glyphosate is a better choice for elderly people as it does not stay in the system as long as other ones. Side effect of the sulfonylureas is weight gain as well as low blood sugar. So you really have to watch that. And then other medications to consider if you're a diabetic are your statins. So Lipitor and Crestor are the medications that we typically prescribe for cholesterol. It's recommended in patients who have diabetes aged 40 to 75. These help reduce the risk of cardiovascular disease, so your heart attack and your stroke. ACE and ARBs, common name is lisinopril and losartan. These may be prescribed in patients with diabetes if they have high blood pressure or to help protect kidney function. So the early onset of kidney complication, they might be prescribing these medications. And then insulin therapy for type 2 diabetics. When do we start this? If your A1C in patients who remain uncontrolled after 3 months of triple therapy medication, so we'll typically start you on an oral medication We might bump you up to 2 medications if you're uncontrolled, and then a third one. If you're still uncontrolled after that, then we'll start an insulin, usually a long-acting insulin. Also, if your A1C is over 10, I've had people where they're diagnosed diabetics and their A1C is 13. We would start them on a long-acting insulin at that time. Symptomatic patients, especially with weight loss, I just had a patient in his 80s. Blood sugars are through the roof, and he's been losing weight. I suggested to start him on insulin. He didn't want to. He kind of bucked me on it. Eventually, he did decide to get on some insulin, and then we were able to lower his blood sugars, and then he also started gaining some weight too. And increased risk of hypoglycemia. So you got to watch that with the insulins. Got to make sure you're checking your blood sugar. All right, so diabetic screening test to prevent complications. So we do your A1C check every 3 to 6 months, depending if you're uncontrolled or controlled. If you're a controlled diabetic, we usually check every 6 months. If you're uncontrolled, we do every 3 months. We also do diabetic eye exams at least once a year. If you have diabetic eye complications, you should be getting them checked more frequently than once a year. We do foot exams at least once a year by the provider, but you should be checking your feet on a regular basis, usually every day when you get out of the shower. Make sure your feet are dry and check your feet for any open sores, anything like that. Kidney function test. We check your kidney function through urine and blood at least once a year. Again, if you have kidney complications, we check that more frequently. And then blood pressure checks every office visit, cholesterol checks at least once a year. And that concludes my presentation on diabetes. I'll take any questions you guys have.
Hydration. How much and what? I mean, you need to drink water.
Yeah, so
Suggest water out of the bottled room. Now let's stick it. You stick it in on suggest bottled water because the way it's filtered, because the way it's filtered, in the bottle. But how much and at what? You talked about coffee. You talked about tea. Are you allowed to have different kinds of tea and different kinds of coffee? And how often are we allowed to drink those? Are we allowed to add milk or anything to it as well? So forth like that. But how much water or hydration per day do you think a person needs?
yeah, so
Diabetic, are you talking 1 cup of coffee a day or 4 cups of coffee a day? How are you allowed to have that much? And all our tea, and like I said, different flavored waters and so forth. All those are hydration. But to what extent and how much? Especially based on where you're at on your diabetes.
yeah, so we typically say 8 glasses of 8 ounces, so 64 ounces of water. We typically say with the caffeine, because caffeine dehydrates you. So 1 to 2 cups of coffee a day, any more than that, probably not good for you. And then if you're drinking coffee, you also want to replace that with water as well.
Okay, now you have a lot of different flavored coffees, different flavored teas. You have different flavored coffees, different flavored teas, sparkling water, and all this. Are we allowed to drink that? And what do we look for in those? I mean, we're looking for 0 sugar. Is there anything else in those that we're looking for? Are we looking for carbs as well? Is there a certain level of high? How high are we allowed for those to be in our drink?
So yeah, you're right. You want to watch your sugar. you want to watch the label for sugar and carbohydrate. Carbohydrate is the same thing as a sugar, so you want to watch both of those when you're looking at labels. But I mean, some people, like in the office, a lot of my patients don't really like drinking water, so if they want to flavor their water, that's fine. But just make sure it's not like chocked full of sugars as well. Like
How high is that? 'Cause you're taking your whole day, you're dehydrating, but you're also eating during the day. So when you put these together for a level where you're allowed to have and not being over, how high is high?
yeah, I would say if you're drinking, you really shouldn't be drinking your calories. I mean, honestly. So like sugared sodas, you really shouldn't be drinking. So you really, like if you're looking for a water flavor, you just want to make sure it says 0 sugar. But I mean, if that helps you drink water at the end of the day, that's fine. Yes.
Hold 1 second. Can you ask the question on mic? It's on
Okay.
Facebook.
I know you mentioned Whole Foods, and you had blueberries on there. And a lot of times, when I'm talking with people about eating whole foods, and I mention fruit, they'll say, I have diabetes, so I can't eat fruit. So what is the story with fruit and diabetes?
So berries are actually the most diabetic-friendly fruit there is. So you really have to watch how much fiber and how much sugar is in a food. And we actually give patients packets with fruit and how much carbohydrate is in one serving of fruit to help you kind of pick what you want to eat. So I'd say berries are the most diabetic-friendly fruit that you could eat, but you also want to watch portions. So like you don't want to eat a whole pint of blueberries at a time, or you don't want to eat like 5 bananas at a time. You got to watch your servings.
Okay, so I'm kind of thinking with that along the lines of you saying don't drink your calories. So I guess, would it be fair to say when it comes to fruit, eat whole fruits and don't drink fruit juice?
Correct.
I guess I got another question if nobody else. So I know a few people who had diabetes and then brought their blood sugar back to normal without medicine. What is the hope that a person could, once they're diagnosed with diabetes, become normal as far as their blood sugar again, without, having to use medicine and things like that? And what does it take to do that?
So that's a common question I get. Can you reverse your diabetes? So once you become diabetic, you can never not have that diagnosis of diabetes, because your body's always going to have the propensity to have elevated blood sugars if you veer off of your lifestyle and diet changes. But there are a lot of people who can manage their diabetes with diet and lifestyle. Really depends on how long you've been diabetic and how long it's been uncontrolled as well. So if you go to the doctor for your annual screening and we're monitoring your blood sugar, and then, the one time you go to the doctor and your blood sugar is, your A1C is 6.5, and you start doing the diet and lifestyle changes, there's hopes that you can get it down to a normal level. But
So you're basically saying if you have a lifestyle that brings it down to normal, you'll still be, technically you'll still be somebody with diabetes, but as long as you stay on that lifestyle, you'll
be a controlled diabetic.
You'll be a controlled diabetic and maybe won't need medicine or insulin.
Yes.
I just want to add a little comment to what he was addressing, because for the past several summers I've worked for 3 weeks for Central Ohio Diabetes Association. as the canoeing bus driver, to be clear that it's not a medical person. Okay, but this is what I want to say, is I listened to these teenagers getting on the bus just talking, and they had been at camp for a week, and the food there is excellent and healthy, very well proportioned and all of that, to try to teach proper proportions and what healthy eating looks like and all of that. And the kids were getting on the bus on Thursday after being there since Sunday, and they're going, this is the most controlled my blood sugar has been in forever. And they're just talking about how amazing camp was, that their sugars are under control. Well, they're running up and down the hills at Mohaven, because it does happen at Mohaven, and they're eating a healthy diet. And they're seeing a whole difference in just under a week, and being kind of excited about it. I don't know how long it lasted once they got home, but I just wanted to say, you're talking lifestyle changes, and for many of those kids, that week at camp is a lifestyle change for that week anyway. And I love going there and working because the food is so good, and all I got to do is drive the bus, and they make wonderful food for me. But anyway, yeah, I just wanted to give that little testimony to lifestyle.
With regards to children, you had earlier stated that type 2 diabetes is increasing in children. What do you attribute that to? Diet,
inactivity.
family history, inactivity?
Inactivity. Sitting in front of and playing video games instead of going outside.
And playing. Very good. Thank you.
I think also with kids, one of the leading cause of diabetes is obesity.
Yeah,
And
obesity.
insulin resistance because of fat cells.
Yeah, so they're not
So-
getting activity, they're just being
Yeah.
sedentary and,
Right.
yeah.
A1C, that report is good for how long period?
The A1C, every 3 months.
Only 3 months.
I'm holding it for you. And do you want to explain why it's good for 3 months?
So, blood sugar builds up on your hemoglobin blood cells. Your hemoglobin, your red blood cells, have a lifespan of 120 days. So, that's how they measure 3-month period. Don't ask me how they get the percentage. That's above my knowledge, but yeah, it's the 3-month.
Any other questions?
I can help you.
No, it's going on.
On A1C, they said that hemoglobin actually, the type of hemoglobin can be different, like hemoglobin S, sickle. There is probably a false reading.
Yeah, I really can't speak to that. I'm not knowledgeable in that, but I do know that we check universally the A1C. We do it through a finger prick in the office. We can test it, or we can do it by blood. Usually the blood test is just a tiny bit more accurate than the finger stick, but we interchangeably use them to monitor blood sugar and diabetes.
So for people with type 1 diabetes, since they're supposed to be on insulin for the rest of their life, but the doctor keep decreasing the doses to a point where they say like you can hold the insulin, what happens to your body at that time? Because you keep getting like low glucose levels when you're on insulin and you're type 1.
So type 1 diabetes is a lot more complicated than type 2 diabetes. In our office, we don't really manage many type 1 diabetics. Those are usually managed through endocrinology. But I do know with type 1 diabetics, you really have to be more strict on your diet and carb counting, because you can't, so if you're going to take insulin, you can't just eat like a bird. You can't eat like a little bit. You have to like account for how much carbohydrate you're going to eat during that meal and take your insulin according to that. the type 1 diabetics we have in our office have insulin pumps, which I think is amazing. Some of the insulin pumps that we have, the insulin pump can automatically read your blood sugar and then give you the allotted insulin dose for that, for what your sugar is. Does that kind of make sense? Does that answer your question a little bit? Yeah, so you have to really be carb counting more accurately when you're a type 1 diabetic. Because if you take a set amount of insulin and you don't eat enough, then it'll drop your blood sugar. And then you also should be eating more protein as well as a type 1 diabetic. Does that answer your question more?
Yeah, so what happens to your body if you're not taking the insulin?
If you're not taking insulin,
And you're type 1.
so the acute complications I was talking about, you can end up in ketoacidosis, so your blood sugar is through the roof, and then you're building up acid ketones in your body that ultimately lead to coma and death and other acute organ failure that goes along with that.
So how long after you stop taking the insulin would that happen? Is there
I think that
Yeah.
is subjective.
Yeah, it's subjective.
So I had a 23-year-old patient that decided that type 1 decided not to take insulin, and they found her unresponsive. Nobody knows how long, but she eventually passed away in the hospital. So if you're type 1 diabetes, you got to watch your diet because you have gastroparesis, you have no production of insulin. If you take too much insulin from your pump, you'll drop your sugar. If you don't eat well, your sugar can go very high. So it's very critical. You have to monitor patient to patient, unless you get a pancreatic cell transplant. You have a question?
I have a question about bananas. I like to get up and have a cup of coffee and like a banana for breakfast to start, compared to having a muffin to start. Now, if I eat a banana for breakfast, and then I decide to have one about 1 o'clock in the afternoon because I don't really want a heavy meal that's too close to where I want to eat, would I be eating too much fruit in one day by having 2 bananas, or if I had a whole apple instead of a half an apple in the morning and a half an apple in the afternoon, would I be eating too much fruit in one day?
I don't think
Bananas is my problem. I love bananas.
I don't think eating 2 pieces of fruit is overkill, but I think when you're eating fruit, especially a banana, because banana has less fiber, and I mean, a lot of my patients, especially when they're on the continuous blood sugar monitor, will tell me I eat a banana and my sugar goes straight through the roof. So in that instance, if you're an uncontrolled diabetic, probably eating half of the banana, but pairing it with a protein and a fiber source, just kind of to buffer that spike. So if you pair sugars and carbohydrates with a protein and a fiber, it kind of slows the digestion of the carbohydrates.
Balances it out.
Yeah,
better.
so it's not like a roller coaster.
Well, I notice more and more people are doing the monitoring on the arms and so forth. Let me tell you that hitting your fingers, the tip of your fingers, maybe 3 times a day or even twice a day, they really start getting little nubs on the end of all your fingers. Gets nubs, and they hurt. Doing your testing, with a needle, that really hurts. It's torture. So I see this now with more so than that. Is there something else that might be coming on the market similar to that? I'm sorry. Something similar to that on the market? Because having that, putting that on you, wintertime or whatever, putting clothes on, it's kind of, you have to watch how you put your clothes on with that on. Is there anything else coming on that might be less large enough or so visible on the arms and stuff?
I don't really know of anything coming on the market, but I've worn one of those Libres, and they're very comfortable.
I can answer that because I've read about this stuff. It's not out in the market, but it's actually the invention is actually started in India, So eventually it'll come to the US market. You can monitor blood sugar without any blood. It's done through infrared, like a pulse oximetry. And I actually know a couple of those guys that are involved in the study and research. It's going to take a few years for that to come, but that's the future that you can, yeah. And to ask you a question, because you asked a question about bananas and you love bananas and you're a diabetic. So one of the things Nikki was sharing throughout the whole conversation is awareness of what you're eating. So have you ever asked yourself how much grams of sugar is in that one banana that you're eating? Yeah. So this is just pointing out our awareness. It's not what you eat, is do you know what you're eating? And eating a banana or 2 a day is not wrong. But eating 10 bananas, each banana has about 18 grams of sugar in it, I believe. And it's good, it's fruit sugar, so it's processed a lot more easier. So I think part of our conversation in our slides is just to be aware of your carbs, calculate your calories. If you take those initiatives, eating a banana is not going to bother you. I want to just take a little time to answer the gentleman's questions there about the A1C with hemoglobin varieties, if it's okay with you. Okay. I just want to make sure that if you have some hemoglobin issues, if you're anemic, if you're sickle cell, or you have some other issues with your blood count, it will alternate A1C. So a lot of times sickle cell people get undertreated for diabetes. And particularly if sickle cell is more prominent, thalassemia and Mediterranean people. So it does alter the lifespan of, because A1C is the lifespan of the red cell. So it does alter it. I have one question, and I might have an answer to that too. I'm just going to ask out a trivia. What does the word diabetes mean to all of you? What does the word diabetes mean? Is it high sugar? It's a trivia. I ask all my students that rotate with me from medical school. So the word diabetes means the flow of water. And mellitus means sweet, honey. So somewhere many, many years ago, some guy tested a urine, it was sweet, and that's the where diabetes mellitus came from.
I know we kind of focused on if you have diabetes, but my question is, if you take the lifestyle that you are recommending for people with diabetes, there's things like don't drink calories, eat whole foods, et cetera, what is the wisdom of saying, I'm going to do a diabetic management lifestyle even though I don't have diabetes, and what is the likelihood that I could make it so that I never get diabetes if I do those sorts of things?
Yeah, so I think everyone should be eating whole foods. I think everyone should be eating this lifestyle. It's not just for diabetics.
Yeah, because there are a few people in my family, in my family tree who have had diabetes, and I'm at the age where they had diabetes and I don't. So I'm wondering, is that lifestyle that I'm practicing, is that maybe what's keeping me from having diabetes?
Yeah, so personal story, my mom does have type 2 diabetes. She was diagnosed in her 40s, and I consciously eat healthier, make healthier options so that I lower my risk of developing type 2 diabetes. So yeah, that would be on the right track.
And one more thing, that's a good question he asked. The dietary modification is very good. But also there's studies showing that people that don't have proper sleep patterns, there's an increased risk of basal blood sugars because of sleep issues. So sleep is a great way to control your blood sugar. proper sleep. The other thing is also there has been an association, maybe you can touch on this a little bit, Nikki, or should I ask the question, with stress.
Yes.
There is a high association with stress and diabetes. So these are things that you have in your control apart from diet that you can focus on behavioral changes. Oh, sorry, Kristen.
Well, I have a question. How much fruit can you get away with if you only eat stuff like donuts and cookies and whatever, say once a week? How much? Because I eat a lot of fruit, but I don't know if I'm setting myself up for a problem or not. So, anyway.
Yeah, so I think really eating in moderation is key. So, I mean, I wouldn't eat 10, 20 bananas, it's all about moderation. I don't know, eat a piece of fruit a day, but really, there's a lot of things that you have to take into consideration too. Like, do you have diabetes in your family? Do you know what your fasting sugar is as well? So these are all factors that you have to take into consideration. I mean, fruit is good, don't get me wrong, but too much of a good thing can be bad.
I have one question. Do you want to go? I can ask myself.
Well, yeah, I just had a quick question. So I've been seeing a lot lately, just saying how cinnamon will regulate your blood sugars, soursop tea, which I never even heard of till a few weeks ago I saw. Do you know anything about those things, or how much truth is there to it?
So, yeah, I've heard the claim that cinnamon does reduce blood sugar, but also the cinnamon in the capsules, I think, has some detriment to your liver as well. So you got to really watch.
So just that powdered sugar, not powdered sugar, powdered cinnamon that you get in the baking aisle that you can sprinkle on your applesauce or whatever. What is that? Is there, I mean, I don't, is there any harm to that? Is there any good to that? Besides whether you like it or not, I mean, is there any good to it?
Yeah, I mean, I would use it sparingly. I wouldn't be dousing my food with cinnamon.
Okay.
Or taking large amounts of cinnamon supplements.
Okay, I just wondered, because I was thinking about that earlier this afternoon, then I almost forgot when I was here. Just stuff I've been seeing lately that's just popping up here and there, and I don't know, a lot of things are clickbait on the internet, and I don't click a lot of things.
In regards to supplements, they're not stringently monitored or regulated through the FDA, so you got to really watch. You don't really know how much you're getting in a capsule of a supplement, so you really have to watch.
Okay.
I mean, those are all natural, but natural things also come with some complications too.
Okay.
Have there been any studies done on vegetarians and diabetes in terms of, vegetarian diet, whether it's lacto or whether it's normal? Anything on this at all?
Yeah, so there are some doctors that study the blue zone diets. Yeah, there is some. They have done research on the blue zones in diabetes. The typical diet to control diabetes, the Mediterranean diet, so a good amount of the lean, healthy protein, the whole grains, and the healthy, non-saturated fats would be the best option, a well-rounded, balanced diet.
Thank you.
It's interesting that you asked that question, because when I was in a research project at Cleveland Clinic for my severe pulmonary hypertension. I was tested prior to all of my other issues I have. I have scleroderma and gluten and anemia and a lot of other stuff. But prior to that, I was pre-diabetic, okay? Once my 8 doctors got me all lined up and everything, and I got into the research project my pulmonologist asked me, I was put on a Mediterranean diet, and I use olive oil, okay, a certain kind, okay. It's very expensive, but very good. And I am not a diabetic. And during that research project, I also did some reading, and I also asked questions to the nurses and doctors who were doing this research. And they're finding out that people that have my diagnosis do not have diabetes, and I do not have it. So the good diet, the Mediterranean diet, is a really good one. And I was given that diet while on this research project, and I worked with girls from Case Western Reserve. I would meet with them at least 2 or 3 times a week. And beans, beans, and more beans. Because it was just a wonderful time, and I got lots of recipes and things. So diet is very important.
Yes, I agree.
So I'm just thinking, and I don't know how much those other medicines cost, but I'm just thinking, how much does it cost to change your diet versus medicine? And how much cost can you save on medicine by going with diet?
Yeah, you can save a lot of money changing your lifestyle and eating habits. A lot of people don't want to change their lifestyle, so then, they have to be on medication. But even if you change your diet and lifestyle, there still might be a time where you have to be on medication. But we always make sure we're doing what's cost effective for the patient. You're right, some of these newer medications are not well covered under insurance, but we do our best to get you on a medication that is covered under your insurance plan. But yeah, I still think diet and lifestyle is key to managing, especially type 2 diabetes. But there still might be a time where you do need medication to control your blood sugar.
I have another question. So I know someone who ate lots of desserts and things and whatever, and in their 60s got diagnosed with diabetes and started religiously following the diet she was given and taking medicines and whatever. And now she has pancreatic cancer, and I was just wondering, because I just read something once that some of the diabetes medicines can cause that. Do you know anything about that?
I do not. Do you, Dr. Rajan?
I don't know. What about you, Mina? No, not that I know of. It's unfortunate she got pancreatic cancer, though. She probably has family history and. Yeah. Any other questions? Oh, Jim.
Of course, when we talk about diet and so forth and lifestyle, we gross over the word lifestyle because exercise is one of the 8 laws of health. I mean, it's got to be regular exercise. It can't be just jogging around the block, but it's got to be something you do regularly. And to put a plug in, there's exercises to school every Tuesday and Thursday at 6 to 7. And it's good aerobics. And of course, walking is the best exercise because you're outside in the fresh air and waving your arms and walking fast. So, and like she says, beans, you have to have your beans. The fiber helps you with your assimilating sugars.
Yeah, so the goal is 150 minutes of moderate intensity cardiovascular exercise, but sometimes it's not feasible for everyone to do that much in the beginning. So we say any movement helps, even if you start 5-10 minutes a day and work your way up to what you can safely do.
Amen.
I don't think, no more questions? No. What an amazing talk today. Thank you so much, Nikki. You did a fantastic job. Really appreciate you coming out. Maybe we'll put you back on the schedule for next year, same talk again. So this is a series of talk we're doing with Health Ministry. We did diabetes, and I'm hoping she'll do another talk from endocrine sometime down the year. I mean, there's so many other topics we can talk about. Thanks for coming out. Our next meeting is going to be, you can mark it on your calendar, is June 28th. And we're going to be talking about advanced life planning. It's a very complicated decisions we have to make when we get older, or even at my age, I've made some advanced life planning that so my family knows what to do if something would happen to me and I can make certain decisions for myself. So we're going to have a physician. She's coming from Altman, and that's what she does. And she's going to come and talk to us about advanced life planning. And she's going to have forms you can fill out and assess where you stand in your life plan. Nikki, you said you have something for all of our people here, right? You can talk.
Oh, yeah. For anyone who's diabetic or who knows someone with diabetes, I do have the Libre coupons. They're the continuous blood sugar monitor system. If anyone's interested in that, we get a ton of these in our office. And then I also have like a demo kit of the Libre. If anyone's interested, just taking a peek of this, at this.
Yeah, you can come and try it out. You have to have diabetes to get it. They won't give it to you otherwise. So you don't want to get diabetes, but for you to get that, you got to get diabetes. Yeah. And I want one more thing. I don't know, Nikki, do you want to talk a little bit about your practice, and are you accepting patients, or that's something you want to not discuss today? Because I know it's business and we don't want to do it. But she does practice, she does endocrine, and she goes to our church. So if you have any questions, you can talk to her afterwards.
Yeah, so I work at Community Healthcare, Inc. I work in the Manchester office off of 93. There's currently 1 physician and 3 nurse practitioners. We are accepting new patients, and we treat a whole variety of chronic conditions.
Is your office somewhere in Akron? Or?
It's off of 93 in New Franklin, right by the Portage Lake State Park.
Nice.
It's right off of Route 93. It's about a mile south of the Portage Lake State Park on the left-hand side.
Manchester Road, all the way south. Manchester Road, okay.
Mm-hmm.
Manchester. I use Manchester, okay. It's like a south, right?
Mm-hmm.
Yeah. Well, thank you again for coming, and have a good evening. We'll see you next month, June 28th. All right, thanks.